Hi everyone, this is Dr. Merhut. I'm here with Dr. Forback. We're continuing our Elite Education series. Today we're going to be talking about pregnancy and some things that we do to treat some of the aches and pains that go along with the course of the pregnancy. Dr. Forback is how far along?
32 weeks.
32 weeks, and so we've been treating her basically on a weekly basis. This morning she actually had a little bit of a fall, so we're going to show you a little bit of what we do for someone that is pregnant, how that's done with the treatment. The nice thing about the office, we have the table here. Normally, when you get to a certain stage within the pregnancy, you can't lie on your belly. This table allows the patient to lie on their belly because this piece right here drops out. So the belly, there's no pressure really put onto it. It's actually really, really comfortable for the patient themselves. So it takes a lot of the stress off the low back. Low back's a really common complaint that we see with pregnant women. We also see some complaints of pain in the front of the groin area. So we're going to be going through a couple things on some soft tissue work and then some low-grade mobilizations that you'll see that we do for people that are pregnant. So I'm going to take Dr. Forback, bring the table down for her so she can get positioned, and then we'll start and I'll explain some of the things that I'm doing as I'm doing them. So I already, previous to starting the video, I did a couple assessments on her, figuring out where exactly the dysfunction is in her hips and also throughout the muscles in those areas. So based on that, those are the areas I'm going to be treating. Normally we do an assessment prior to treatment to figure out what needs to be treated during that visit. I already did that, and for time's sake purposes, we're just going to be explaining some of the things as we go instead of doing the actual assessment. So one thing just to start off before I do any treatment itself is explaining a little bit with the pelvis. So there's a ligament that attaches to the sacrum, which is also considered, a lot of people consider it the tailbone. There's a ligament that attaches there and then goes to the ilium, so it goes in between there. That can cause rotation within the sacrum itself, so one of the treatments you'll see me doing is I'll be contacting that ligament in that area to help reposition and take some stress off of the low back. Sometimes it's a little bit tender, but we've been working on her consistently, so it's a lot less tender than it initially was the first couple times we did it. Same thing, we're going to work on a little bit of muscle that attaches to the hip right here and then comes around this area. So some of the work will be a little bit through the gluteal region, and you'll be seeing that in a minute as I work through that area. So to start things off with her, I'm going to work with doing some of the muscle work on the outside of the hip, right through here. Literally it's just simple pressure through that area. The first couple times it may be a little bit tender. Our goal is to decrease that tenderness through the course of the treatment. So if we're doing either a couple times a week or weekly adjustments through that area, that tenderness and that tension through those muscles is a lot less as we go through the course of the treatment. So another thing I monitor as I'm going through the treatment is just the tension through the low back. The muscle work and the low-grade mobilization that I'll be showing has a direct effect on the erectors, which are the muscles back through here. So I just monitor that area as I go through some of the soft tissue releases that I'm doing to see also if it's having the correct effect on the lumbar spine erectors, the muscles towards the back. So I use a combination of different techniques. I don't just stick with specifically one technique when I'm treating pregnant women. I use a technique, basic technique, which was Logan basic technique. I use a little bit of Webster technique. I do some soft tissue mobilization techniques as well, and kind of combine all three of those treatments into my own. And for Dr. Forback here, like I said, we've been treating her for a couple weeks, and she's been having really not a whole lot of pain at all, but because of the little bit of fall she had earlier this morning, we're going to get her up and moving again so she can treat her patients today. Okay, so then the next one I already described is going to be that ligament that attaches to the sacrum. So for her, I checked earlier, The right side is the one that's tense and taut for her. So literally I'm just going to apply some pressure to that ligament and also assess through the low back, the lumbar spine, and the lumbar rectors, making sure that those relax the way that they need to. I can also do a low velocity, low amplitude style adjustment through that area, where I'm literally just applying pressure into the lumbar spine at different spots to help relax some of that musculature and help reposition and take some of the stress off some of those joints through the low back. And Dr. Forbeck would be able to tell you, I won't ever talk right now, but she'd be able to tell you that there's some couple tender spots as I go through the treatment, but overall it's a pretty comfortable treatment. Alright, then I would take a deep breath in, all the way out. Good. Alright, the next one is going to be low-grade mobilization through the pelvis, so a little bit through the SI joints. This technique is called a sacral unlock, so I'm going to be applying pressure down through the pelvis, right through here, right over top of the SI joint, and then Dr. Forbeck is going to be rocking her hips up and down the table, and so she's going to be basically doing the adjustment for herself as I'm applying pressure and blocking certain areas to allow that mobilization. Sometimes with this, we'll get a little bit of a cavitation, so you will sometimes have that popping, clicking sensation that you get with more of a high velocity adjustment that a lot of people are familiar with during the regular adjustments. Another thing I'm doing right now is just taking the sacrum and helping it rock backwards a little bit. Oftentimes with pregnancy, that extra stress through the low back happens because the sacrum will rock forward a little bit, putting a little bit extra stress through that area. Then we'll do a little bit of low-grade mobilization through the lumbar spine using the same technique. And we had a little bit of a cavitation right there. And last one. Okay. And then we'll do a little bit of work on the hamstrings, find just little areas in the hamstrings that are taut and tense. The hamstrings directly attached to the pelvis. I mentioned that a couple times in some of the other videos, so it can help with releasing some of that tension that's put on the low back because of the tightness through the hamstrings. So I just find different areas that are tight through the hamstrings, apply a little bit of pressure to help release some of those muscles. And then one of the last things we'll do, this is called a round ligament release. So I'm going to have Dr. Forbeck flip over onto her back. And I'll lock that piece up so it doesn't fall out anymore. So the round ligament release, this round ligament is actually what suspends the uterus. So if there is torque within the uterus, if it's twisted in a certain way, one of those ligaments that's suspending that uterus is going to be really taut and tender. Oftentimes people will complain about that groin pain that they have throughout their pregnancy. That is usually caused by this round ligament tension. So it's another real simple soft tissue release. So I would just find the round ligament, which is usually in between the belly button and the front of the hip, so the hard part, that bone in front. I just figure out the tension on either side, which one's a little bit more tense. And then I'll simply just apply pressure through the round ligament until it releases. Oftentimes, within the past couple weeks we've been doing this, her baby, I don't know if they like it, they don't, but we usually get a little bit of a punch or a kick, so we know it's definitely in there moving around and healthy. So again, this one may be a little bit tender at some times. The first time we did it, it was a little bit tender. The past couple of times we've done it, it's been a lot less tender each time it decreases. Our goal for her is for her to not have any of that pelvic pain or groin pain that a lot of people come in with. So we want to try to prevent that from happening because she hasn't had that yet. So we don't want that to occur. So we're doing a little bit of proactive work by even releasing some of the tension, even if it's just a little bit. Okay. And it's as simple as that. So that was a simple treatment that we typically do on someone that comes in that's pregnant. It may be a little bit different from person to person based on what their presenting symptoms are or the different muscle groups that we see that may be tense or not. So usually Dr. Forbach, after she's done with the treatment, she's great. She can walk around and treat her patients throughout the rest of the day. If you know someone that's pregnant experiencing any of the things that I talked about, or if they have more questions about different types of things that we do to help treat that thing, feel free to share this video with them. This is the Elite Education Series with Dr. Merhut and Dr. Forbach today. I hope you tune in next week to see what we're going to be talking about then.